Hello viewers, this is Pratiksha Mes, a student of 4th professional year of Lakhimpur College of Veterinary Science. I am going to present on the topic tuberculosis, which is also known as Pearl's disease or scrofula. The presentation has been prepared by UG student of Lakhimpur College of Veterinary Science, AAU, Assam, India. Therefore, the information collected may not corroborate to the findings of deep research work carried out in respective field. However, utmost care has been taken to provide correct information. No information of this presentation should be considered for scientific work without verifying the information. It has been prepared only for educational purpose and not for commercial purpose. Further, the information of the presentation should not be used for the treatment without considering registered practitioner. So we are going to start with the etiology. The disease is caused by species of the genus Mycobacterium. Based on the host affected, it is divided into bovine type, human type, avian type, volibacillus. Different species of Mycobacterium affect different animals and human beings. Cattle are mostly infected by Mycobacterium bovis and tuberculosis. Humans are infected by Mycobacterium tuberculosis and bovis. Horses are majorly affected by Mycobacterium bovis, but are also infected by tuberculosis and avium. Dogs are infected by Mycobacterium bovis, tuberculosis and avium. Pigs by bovine, human and avian type, and birds by Mycobacterium avium. The organism is a slender, rod-shaped, single or pair or in group. The cell wall of the organism is rich in mycolic acid and sulfur-rich glycolipids, which facilitate the bacteria to take up certain dyes like aniline and Ziehl-Neelsen stain. It is an acid-fast organism. The cell walls contain lipid and sulfur-containing glycolipids, and so virulent tubercle bacilli destroy the phagosome and causes failure of phagolysosomal fusion, and so there is survival of Mycobacterium within the phagocytic cells. Physical and chemical features of the organism. It is a slow grower in laboratory media and it is sensitive to heat. It is killed by creosote and sodium orthophenolate. It is resistant to chlorine and 6% sodium hydroxide. It remains viable in organic materials. Epidemiology. Prevalence of infection. Tuberculosis is prevalent worldwide, both in animals and human beings, and in India, both in animals and human beings. TB is endemic. Economic impact. Apart from the mortality, there is also productive loss. The disease is relatively common in pigs. Discarding and condemning infected carcass at slaughter should be practiced. Predisposing factors. The predisposing factors of the disease are overpopulation in small area, purely intensive rearing, intercurrent infection, poor sanitation, inadequate ventilation, vitamin A and C deficiency, young age groups, and malnourishment. Source of infection: exhaled air, feces and infected meat, nasal discharge, sputum and tracheal mucus, contaminated inanimate and animate objects, reproductive discharge, feed, water, and soil act as a source of infection. Reservoirs and carriers of infection. In India, infected animals and human beings act as a source of infection. Transmission. The disease can be transmitted by nasal discharge and tracheal mucus. Ingestion. Common use of feed and water troughs. Ingestion of tuberculosis infected animals' meat and their products. Direct contact with infected animals. Inhalation of droplet nuclei from aerosol, and congenital infection by vertical transmission. Host affected. Cattle are the primary host, highly susceptible for the infection. Purebred and crossbred are highly affected as compared to indigenous Zebu cattle. Sheep and goats more or less resistant to infection. Badgers, possums, pigs, dogs, primates, large cats, and elephants other than cattle are affected and act as maintenance host. Pathogenesis. Once the organism is inhaled, it will get lodged in alveolar surface of lungs and its bronchial and thoracic lymph nodes. Organisms entering through ingestion reaches pharyngeal and mesenteric lymph node and gets locked up there. Within the corresponding lymph nodes, the mycobacterium undergoes multiplication and develops small tubercles called Ghon's focus or primary complex of infection. After that, the bacteria reaches circulation through lymphatics and spread into other body cavities due to drop in immune response. As a result, the bacteria overcome the killing effect by host immune mechanism and causes infiltration and necrosis of neutrophils. Together with the bacteria and dead immune cells are surrounded by multi-epithelioid cell layers, which is called as Langerhans sign cells or granulomas, and further this is surrounded by lymphocytes and fibrous connective tissue. Clinical signs. In general form, we can see docile, lethargic but bright and alert animal. Cows with prominent miliary tubercle lesions are clinically normal. We can see progressive emaciation with capricious appetite, fluctuating body temperature and rough hair coat. In spite of good appetite, the animal does not put up weight. All these general signs are pronounced following calving. Respiratory form. In respiratory form, we can see silent or paroxysmal cough, especially during early morning and chilled weather, chronic cough due to bronchial pneumonia, followed by rapid respiration and dyspnea due to enlargement of bronchial lymph node and obstruction of airways. Squeaking crackles are audible but noise audible over the caudal lobes. Enlargement of retropharyngeal lymph node causes dysphagia and noisy breathing due to pharyngeal obstruction. In reproductive form, we can see metritis and inflammation of placenta, which leads to infertility, abortion, and failure in conception. Nervous signs. In horse, painful cervical osteomyelitis causes stiffness of neck and difficulty to eat. In sheep and goats, we can see bronchopneumonia and terminal dyspnea, intestinal ulceration with diarrhea, which is rare in cattle, enlarged lymph node of alimentary tract, kids more progressive to early death. In pigs, TB lesion is found in the cervical lymph nodes. In horses, cervical vertebrae show osteomyelitis and causes stiffness of neck. Zoonosis. It is an important zoonotic disease. There is an increased incidence with an increased spread from animal to human. Mycobacterium bovis is responsible for 5 to 10% of human tuberculosis. Children getting infected via drinking of infected breast milk is also seen. Here we can see the environment is polluted with TB causing organism. Bovine and wild animals are getting the infection and the disease is transmitted to human through infected meat or by other source. Diagnosis and differential diagnosis. Diagnosis can be carried out based on clinical signs and symptoms, palpation of supramammary lymph node essential for suspected TB mastitis cases, and culture or acid-fast staining. Single intradermal test, PPD injection or purified protein derivative injection. It is given at caudal fold at base of the tail in sheep and goats or lateral center portion of neck in cattle is highly sensitive. Initial skin thickness is measured with the help of a vernier caliper, then final skin thickness and inflammatory changes at 72 hours post-injection should be taken. Increasing skin thickness more than 4 mm is taken as positive. Short thermal test. Intradermal tuberculin 4 ml injected subcutaneously in the neck of cattle. Then the initial rectal temperature is measured. The temperature increases in 4, 6 or 8 hours to above 40 degrees Celsius. The animal is classed as positive. Stormont test. First intradermal injection of 0.1 ppd at middle of neck is followed by second injection which is given 0.1 ml after 7 days at the same site. If there is increase in skin thickness of 5 mm or more at 24 hours after the second injection, the animal is considered positive. It is more accurate than SID. Comparative test. For testing the animal for TB along the side of PPD tuberculin injection, 12 cm apart, Mycobacterium avium PPD should be given and the test results should be compared. Then the test results read after 72 hours. This test is not used for initial screening but can be used as a primary test when there is high incidence of avian TB and Jones disease. Gamma interferon assay. This test measures the amount of gamma interferon released from the antigen-stimulated whole blood cells. ELISA is used for detection of antibody, molecular diagnosis by PCR, material SARS, sputum, fishes, milk, blood, etc. Differential diagnosis. Differential diagnosis will be made from lung abscess, pleurisy, pericarditis, traumatic reticulitis, chronic contagious bovine pleuropneumonia, upper respiratory tract infection, actinobacillosis, bovine leukosis, lymphadenopathy, and mastitis. Treatment. There is no antibiotic treatment successful in control of tuberculosis. Supportive treatment are given to enhance the immune response. In some countries, human-use drugs isoniazid at the rate of 5 mg per kg body weight for about 45 days showed beneficial effect. Cow shedding organism in milk can be treated with isoniazid at a rate of 10 mg per kg body weight for 6 to 12 months and rifampicin at a rate of 5 to 10 mg per kg body weight orally for 4 to 6 months. In dogs, TB is not treated as it shed organism in heavy concentration. Prevention and control. Prevention. Animals over 6 months and above should be tested by tuberculin test. Positive reactors disposed of according to local legislation. Suspicious cases must be retested by comparative test. Retesting. If incidence is higher, retesting should be done in 45 to 60 days after desanitization of intradermal injected animals. Annual testing of cattle quarantine. Test positive herds should be slaughtered. Identification of individuals and wildlife reservoir. Accredited areas set up. All cattle in this area are tested and reactors removed and monitored until next generation offsprings become free from infection by test. Control. Disinfection of utensils with 5% hot phenol and cresol. Feeding of calves with milk free from infection. Test and introduction of new stock. Education public about the significance of the disease. Here I have added the reference, a textbook of veterinary preventive medicine by Amalendu Chakraborty and Google image. With this I conclude here. Thank you.